Dr. Livingston here with
TJ Miller.
Okay, and so what we're gonna do for you today, live, almost, is we're gonna go through how a CBP doctor analyzes somebody's posture, spine, and gets down to the nitty-gritty for a chiropractic adjustment, okay? So and even though you're on camera, just be completely relaxed. Good, and then stop, shake your head left and right. Nice, perfect. And then where you think is the center. Good, stay there. All right, and for the stop dead center, so you can already see he's rotated towards my direction, which is the left. He's got pelvic rotation. You want to start with center midline of the body, starting with the pelvis, the hips, and then you're going to find the center of that. Check the center midline where his sternum is, middle of his chin and forehead. And you can see he's rotated. He has his high shoulder on the left. You can also see some translation in his neck if you're well trained. I can see that to this side. Good, stay there. And then we're gonna come to the side. On the side, you can see anterior translation if they have forward head posture, which he has significant amount. Just so the camera can see, that's a lot of forward head translation. Okay, but you really want to start in the pelvis. So his whole thoracic cage is shifted forward. His head's even further in front of that. So if we were to take a plumb line sagittally, you would be way off center. Absolutely not even close. We'll talk about that later, about what the research talks about that and what kind of issues you have associated with health that go with that. See what we were talking about before. You're looking at the center of his hips, and that should be plumb line with his shoulder, AC joint, and his ear, which you can see they each track backwards, right? So he's standing forward like this, which is a very common posture, especially with, what is your main complaint right now?
Low back on the right side into my glute.
Yep, and you brought an MRI, or you brought an MRI reading, and what did that tell us? Do you remember?
Same thing, low back.
You can face
possibly low back, possibly pinching a nerve, going down into the glute, down into my foot.
So just based on his posture, I could have told you, based on my clinical experience, that he's got some type of stenosis in his spine. Why? Because he's got so much forward shifting of his spine, which he does have. They did pick it up on the MRI. I have not gotten to see his x-rays yet. Obviously, the next step is to get x-rays. So we'll cut back to the video later. The point of this is going to be neurology. I'm going to show you how your body, your neurological signal from your brain throughout your spinal cord that transcends every single tissue in your body is going to help correct his posture. It's not going to stay that way, but it will correct it for the short term. And the way we're going to do that is we're going to take the posture that he did have, and we're going to find the mirror image. And then we're going to stimulate his spine and proprioceptors and mechanoreceptors to tell his body he's back in the right position. And you're going to see when he stands back up, if he's not back to perfect, he's going to be a lot closer. And then from there, we'll get him back to perfect. So we're going to take your right hip. We're going to put this pillow under here. All right, good. And back down. Okay, and then he had a ton of anterior translation. So what we're gonna have to do, if I had a different table, if I had my table, these would pop up, right? So I'm actually gonna have to ask you to kind of bridge up a little bit so I can put this pillow underneath your stomach. All right, perfect. And then this headpiece has to come up. So since your left shoulder was higher, what I do is I take this arm, stay nice and relaxed, and then we're gonna pull it down, put it under your thigh. Good, perfect. His feet were rotated, but I believe that they were only rotated based on my experience, clinical experience, because of his pelvic rotation. Okay, so if we recentered his pelvic rotation, his feet would have turned right back into the correct position. That'll be perfect, boom. Okay, and he did have some translation, so actually this will be perfect. So you stay nice and relaxed. I'm gonna translate your head this way. There we go, just like that. I'm gonna lift your head up. Perfect. Okay, so now this is, so you shouldn't feel any pain anywhere at all. This is just neurological input to your body.
Do you know what you should do at this part?
Yeah, or know what?
You should silence it, and you should put the Benny Hill theme song. This thing's going really fast.
What's Benny Hill? Oh, then.
As you're like, and like put it up to like 10 times speed as that thing's like rolling across his back real fast.
So you notice I'm not actually adjusting your spine, right? I'm not taking a specific segment that's out of alignment, which I would be able to tell based on x-ray, which is how you get spinal correction. You have to get those segments that aren't moving. Like those segments that are unstable, you got to get the ones that aren't moving properly to move. Okay, now you can do a lot less stimulation than this, but I really want to get it good because I at least saw the MRI reading, so I want this to be pretty profound. And the beauty about this is that I could just do an upper cervical stimulation instead of everything that I just did. I could just do upper cervical, and the result would be the same. All right, let me pull this out. Oops. Good. And then you go ahead and roll to your side and face me. Good. And then swing your legs this way and push yourself up. Let your legs drop off and then push yourself up with your left hand. Yeah, like that. Perfect. All right. So come on and stand over here. And I'm going to have you walk in place again. And I'm going to move this out of the way. All right. Keep the camera on him. All right, now, all right, well, look at him already, but let's have you stand here, walk in place.
Eyes closed?
Yep, eyes closed again. All right, and stop. Shake your head left and right, left, right, left, right, left, right. I'm gonna move out of the way. Oh my God, okay, now open your eyes. Okay, now can you see a difference?
Yeah.
Okay, now something you didn't see. You might have seen because you know what to look for. Do you remember when we first started, how he was walking?
Yep.
What did you notice?
It was off track.
Off track.
Tracking.
Okay, correct me if I'm wrong here. What Charlie's saying is his cross crawl reflex was switched. So if you ever seen someone on a
opposite.
like this on a, what are those elliptical? It's not an elliptical. It's like
Arc trainers.
Arc trainer, that your leg goes with your arm. That is not a good thing to do in the gym. Okay, don't move. I'm gonna take a picture just so you can see it. So we didn't do anything. Well, you guys saw what we did. It was. I didn't adjust them. But this is why this is part of the medical protocol for spinal alignment to get structural correction. So we'll take a picture, and then I'll have you turn about 90, face. Now he's still forward. His head is still forward a lot, right? But you also got to see, we couldn't really do too much because I didn't have props for that. He didn't mess up again. Good, stop. Shake it out. Good, and now turn, face your left. So he's definitely much straighter. Now, somebody could say, oh, well, he's doing it on purpose. He could be, but based on clinical experience, I'm gonna tell you that he's not. Your word versus mine. Come get me. All right, looks good. Cool, so now is it still going?
Yeah.
Now we're actually gonna adjust them, okay? So now is it still going?
Yeah.
Now we're actually gonna adjust them, okay? So let's get the crack addicts. Let's get the crack addicts what they want. Extremely easy to do. I'm gonna put this here as well, okay? That's good. Just roll back on that, perfect. So if you remember the postural rotations, he was rotated on the right, so we're rotating him back, hence bringing it back to this side, okay? There are drops on this table. They don't sound like thunder, as you hear, but they still get the job done. The best we could do for his thoracic translation forward was lift him back up with this amazingly thick pillow, and same with his head. That's the best we could get with his head for now. Good. We already started adjusting him a little bit. by accident before the camera came on. So I already got some thoracic movement. Now what you see here is not specific, it's generalized adjusting. But we need to get things moving. This is the first time I've adjusted them. We already went through the exam. I want to get things moving properly, as well as I just had a transplant, right? So we want to get things moving, but not kill me, right? What other chiropractors have you been adjusted by?
Recently?
Just in general.
In general,
Two? So as far as like the weight that I'm using and the pressure, does it feel like I'm actually pushing?
yeah, I'm gonna feel it. Yeah.
I know it's kind of a weird question, but a lot of people don't actually get manually adjusted. Most patients say, like when I do especially when I do the cervicals, like our goal is structural alignment. I'm heavy-handed. Why? Because I want to structurally move it, right? So like you're gonna get, it's not gonna always feel comfortable. I can do really light, comfortable adjustments too, but that's not what we're going for right now.
No, I definitely feel it.
Yeah, so like, but it's not, hopefully it shouldn't be painful,
No.
but it is like, yeah. Go ahead, what were you gonna say?
No, it's not painful.
Yeah.
I feel it, yes.
Okay, and this also, just for those watching, this isn't a comfortable position either, but we're putting it there so that, again, just like the mirror image adjustments and the mirror image stimulation, I mean, you could even do this, to be honest with you. That's still proprioceptive input to the body. And maybe at a later video, I will do that so you guys can see how the neurology of the body works. It's pretty amazing, because I have done that before. All right, here's the pillow, this pillow. And actually, we can use it here. Perfect. Okay, so for this one, bottom leg straight and strong. Keep it extremely straight and don't let it move. All right, and then the rest of your body you can relax. What'd you say?
I hate this one.
You hate this one? All right, so scoot towards me a little bit.
My body just
Perfect.
fights it, that's all.
Your body just fights it. The biggest thing that I've learned now, after watching a bunch of other docs, is being okay with having as much rotation as I do with him. So again, the bottom leg straight and strong, that's all you got to do. There we go. All right, face up. This nice and tight because you're trying to open up your shoulder blades. And this stays nice and tight, but the rest of your body completely relaxed. Yeah. And then I also have an instrument too that works really well with this. But you saw you saw how light that was, but he felt it moved really well. Now, whatever is easiest and most relaxing for you. Some people put their hands in their pockets. Some put them under their butt. If you can relax your arms and your neck like that, that's good too. So during the exam, besides the forward head posture, there was a lot of fixation on his occiput. So that was the first adjustment we just did. Probably didn't need a camera to hear that one, or you probably didn't need the mic to hear that one. But he definitely felt it, and it probably sounded really loud because it's near his ears, right? It's the top bone in your neck. But his neck seemed to move pretty well on the exam. There we go. And he's got a lot of muscle too, so you got to really feed in. Yeah, like that. Again, probably didn't need a camera to hear that one, or the mic to hear that one. Good.